Welcome back to this special edition of News in Focus on this Mandela Day. Now, you can see I'm completely different. Generally, you'd see me in studio with a full three-piece suit. Of course, earlier on, you saw me with our Hilaal attire on. But today, we've decided to mix things a little bit. I'm dressed up like I'm actually going into an operation or in theater. And it's nice because we're giving a different look on this Mandela Day. Joining me, I'd like to welcome somebody who plays quite an instrumental role in making sure that the children that come to this hospital are treated in the best way possible, the way our former President Mandela would have wanted all children to be treated. Let me welcome Sister Kesegie Naidoo. Sister, thank you so much for allowing us into your theater. Obviously, we were told to dress up, covering our shoes, our body, and obviously our hair. Obviously, it's necessary for that. Uh, Thank you for allowing us the opportunity.
Thank you, and thank you to Hilaal TV for coming and viewing this important day at Nelson Mandela Children's Hospital and showing the world what we do here.
Here's someone I have to ask you just to come a little forward. Thank you so much. Talk to us about the role that you do. Obviously, theater manager, but it's not just being a manager. You have to have that hands-on service, isn't it?
Yes, no, definitely. So I coordinate all activity in the theaters at Nelson Mandela. I ensure all elective lists and emergencies get done per day, per request, and ensure there is enough stock, staffing capacity, and time allocation for each of these cases. Yeah.
Sister, what does this hospital mean to you, given that it's in honor of our former great president?
It's giving to the children, caring for the children, irrespective of race, religion, or creed. It's just giving, 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 and caring all the way. Yeah.
I was speaking to Dr. Baikucho, the CEO of the hospital, and she was saying the former president, former President Mandela's love for children was something that I think all of us as South Africans still need to reach. How important is making sure that the future of our country is in good hands, especially when it comes to health? A lot of our children are vulnerable at this very moment, but here's a facility that allows the children to be treated in the best way possible.
The success of this organization is encompassed within the individuals that render the service. Each and every one that's employed or part of Nelson Mandela Children's Hospital show love and give love overwhelmingly. And such a project that we are running this week, Kanisa Week, it's not possible if there's no love for children. And children are the future. To groom and to develop children, it's done through the process of love.
I'm looking at the theater. A lot of it is state of the art. That's beautiful because the children are obviously going to be in good hands. How do you separate the professionalism that you do from the emotional aspect? I ask this because when you mention the name Nelson Mandela, obviously there's a lot of emotion that goes to it. So how do you, Sister Naidoo, wake up every morning and say, I'm going to try and find the balance, but I'm going to make sure that the best treatment is given to these children?
It's not easy, and that's a difficult question. Over the years, you see happy moments, you see sad moments, and every day is a different day. However, after a sad moment, a sad day, the next morning you realize you have to come back. If you do not, there's a child we're not going to care for. So it's difficult, and we all go through it, but balance comes back, and lots of spirituality. Yes. This is not possible without God. Yeah.
No, I couldn't agree with you more there. I know I was walking in, myself and Suleiman, our camera operator, and we've seen the children playing. That's what children do. They play, they want to have fun, but obviously, you as the theater manager need to say, it's time to do an operation or treat them. That's where the hard work comes. So how do you handle it as a theater manager, as a sister, knowing that you're doing this? Again, honoring the late president.
Yes, like you've noticed, our theatre, our receiving area is set up as a playground. So before children go into theatre, we relax parents, we relax the children, we involve play as part of the process or the workflow of theatre to make everyone comfortable and to decrease tension. That's one way we do this, knowing at the background our children are very sick. Yeah.
Doctor, what does sisters apologize. Sister, what does Mandela Day mean for you?
So Madiba sacrificed 67 years. He left behind a legacy, and sacrificing 1 week and giving 1 week or 67 minutes for those that can only do 67 is just but a tiny moment in one's life per year that we can do. It's giving back. Yes. We all cannot give in monetary value, but we can give in kind. And that's what we do. Yeah.
And that's the thing about Mandela Day, isn't it? You take away a certain time to make sure that that memory of him is there. And obviously when you wake up in the morning, sister, how do you inspire your staff? How do you say, today we're going to do this, not only because it's Mandela Day, but we are doing this to make sure that the children are treated in the best way possible?
Very good question again. So like I said, we have some difficult days, but we have to come back and continue the next morning. So we start our day here in the operating theatre with a prayer. We do not proceed or begin our surgery without prayer. And like I said, we believe in balance. We include God, and that's how we start our day. And even if our previous day or previous moments have been difficult, the inclusion of God uplifts or removes these heavy shoulders that we have. Yeah.
Sister, you've taken an oath as a medical practitioner to give the best service to patients, to the most vulnerable, which are our children. How does that inspire you personally, knowing that you're working at a hospital which bears the name Nelson Mandela?
I dedicate the rest of my years close to retirement to this hospital. I bring with me all the years of experience and knowledge to give and make this hospital go forward and over to the next generation that comes. Transfer skills and ensure there is this legacy and the continuation of work from one generation to the next.
One final question, sister. What is your memory of the former president? Of course, he left us on December the 5th, 2013. It's been 12 years. But if you were to look at a memory that stands out, what would that be?
So, about 15 years ago, I actually had the opportunity to meet him at a previous hospital, and it was also in memory of a children's program. It was a cardiac center. And I think after that meeting, I knew that my future plans in nursing would be to serve. And that's where I am. Serve Madiba and his legacy. Yeah.
Sister, absolute pleasure talking to you. All the best. Continue the good work that you're doing. We really appreciate it.
Thank you so much. And thank you to Hilaal TV. Thank you.
No, absolute pleasure. That's all we have for you here from the Nelson Mandela Children's Hospital. Don't go anywhere because we're going to be going somewhere else to honor our former president. Do stay tuned.
Hi, I'm Talia Govender. I'm a pediatric surgeon here at Nelson Mandela Children's Hospital. This week, we've endeavored to do many catch-up surgeries for a very long waiting list for our deserving kids. We have achieved thus far more than 80 surgeries and are still going. And it's involved a massive effort from all of us here, but we hope to try and ensure that there's equitable access to healthcare, and that's all what Mandela wanted. Happy Mandela Day.
Hi, I'm Sabrina Solomon, and I'm one of the pediatric surgeons here at Nelson Mandela Children's Hospital. I'm one of a team of 3 amazing consultants who have put together this catch-up week, which is basically in the light of Nelson Mandela Day today. And our logo essentially says, sharing the light of Madiba. And essentially what we've been doing is day cases for patients who've been on very long waiting lists, some 5 or 6 years waiting for their operations, for conditions that could become very complicated for them and in some instances actually even be life-threatening. We, together with our amazing team of anaesthetists, theatre staff, as well as the staff who've been preparing the patients, have managed to come together and do, like my colleague has mentioned, more than 80 procedures. We're still going strong. Today's our last day. And what it means to us is essentially just being that light, as our name suggests in Kanisa, for patients to get what they need to get to help families, to help parents in this day and age, and just have a real positive effect. Thank you.
Hi, my name is Andrew Grieve. I'm one of the pediatric surgeons at the Nelson Mandela Children's Hospital. We're privileged to work in this amazing environment that really caters to kids from everywhere in Africa, both state patients as well as private patients, and we are in this unique position to really offer healthcare to all of these kids. This week we've been doing a catch-up surgical week, mainly for kids who've been on long waiting lists and haven't really had the opportunity to have their operations done. And we really are privileged to be part of a massive team that delivers this level of care, this level of service to all of these patients. And we're fortunate to be sponsored and to be looked after by many donors. The hospital has come to the party. We've had volunteers from other hospitals, anaesthetists, other surgeons all joining us. And this wonderful team really has stepped up and really performed amazingly this week. And all of the patients really have shown their gratitude to us, and it's been fantastic. But there's also many people behind the scenes that you don't see. You know, the porters, the nursing staff, the cleaning staff, the sisters in the day ward, the pharmacy, extra people in the reception. It really is a massive task and a massive team that looks after all of these patients. And I really appreciate being involved in this care and the amazing thing that it does for this hospital and for all of the patients out there. Thank you so much. We'd just like to say on behalf of the pediatric surgeons at the Nelson Mandela Children's Hospital, just a big thank you to everyone that's been involved in the surgical week and the ongoing care of all of the patients at the Nelson Mandela Children's Hospital. And from all of us, we'd like to wish you a happy Nelson Mandela Day.